Okay, here we are on SpineCast. It is Wednesday, Cinco de Mayo, and we're going to be talking about the three most important things to consider when you're dealing with back pain. I'm Dr. Ron Fidella. I'll explain a little bit about who I am later, but what I want to let you know right now, just so that you clearly understand, this is not encrypted. For the participants, I do believe that I have muted both their audio as well as their video or screens. And as we go through this, you're welcome to turn on the video if you want, or you're welcome to keep it off. With the audio portion, I'd appreciate that it being kept mute until we get to the point where there will be questions and answers, and there will be at the end of the session. As you know, if you've attended any of these before, the number of participants varies. I've done this on Wednesday evenings and recorded it and had nobody show up. And then I've also done it where there have been more than 50 participants. So, you know, the point for me isn't how many people show up, it's to provide the best information I can and to answer questions for anybody who happens to be in attendance. Whether that's 1 or 20, it really does not matter to me. Now, as I indicated to you also on the sign up, I don't collect emails. I'm not going to spam you. You won't get endless correspondence from me. But if you would like to be added to the Spine Camp mailing list where I notify you of new blog posts and new videos that I do, then you can go to SpineCamp.com and sign up there. And the only people that I correspond with or send information to are the people who happen to sign up for my SpineCamp.com website. So with that said, what I want to do is get into my presentation so that we can get completed and that I can answer any questions that you might have. So let me get to the screen share here if I can, and I'm going to see what I need to do to get that accomplished. And let's see. Alrighty, I'm going to get to full screen and I'm going to share my screen. And here we go. And here is my presentation. And let's get to the slide presentation from the beginning. All right, here we are. The topic tonight is the three most important things to consider when you're looking for treatment for low back pain. The whole idea is to help you beat back pain and do it in a way that's right for you. So here's who I am. You can see me. I'm Dr. Ron Fidella, and here's a little bit about me. I'm not going to go into this in detail. You can get back to my Facebook, SpineCamp Facebook page, where I post the replays of this and read about it, or you can see more information about my experience on SpineCamp.com, my website. The short story is I've been a back pain consultant for many years. I'm a chiropractor with additional training in neurology who has spent a large part of my practice as a consultant in the neurosurgical department of a large neuroscience practice. So my experience has been a little bit different than many other doctors in that I didn't treat people, but I was responsible for assisting in making the diagnosis and helping the patients who came in determine a treatment approach that fit their circumstances. So I made no money giving treatment to people, but my professional income, I guess, was derived from basically helping those individuals that I work with make good choices and giving them the information that they needed to make those good choices. Years ago, I resigned from that practice. I got burnt out. I didn't like dealing with the insurance companies and some other things. And I devoted myself towards putting together SpineCamp, which is an online service where I work with individuals to remove confusion and to restore control. In other words, to put the treatment of back pain back in your hands by giving you good, unbiased information. So before we go any further, I want to do the disclaimer, and what it basically says is I'm not acting as your doctor. The information that you get here, although I believe it's accurate and it's based on my own personal research, isn't meant to replace the information and guidance that you get from your family physician who's had the opportunity to do a history and to evaluate you in person. And if there are, if there are any differences or conflicts between what you hear from this presentation and what you've been told by your family physician, that I'd encourage you to talk it over with them. My whole purpose is to take this open-ended approach where I don't think I have any conflict of interest and help to give you insider insights into the way back pain is treated and the way I would look at it if I was looking or seeking treatment for myself. So the three things to consider before you choose back pain are, number one, you gotta know what's real. And I'll talk a little bit about that in a moment. And then you have to understand how to assess your personal risk. And we all have the same three risks, and I'll also get into that in a little bit. And then once you know what's real, rather than what you're led to believe, or what marketing pamphlets may show you, or different advertisements, or even news publications, once you know what's real, and then are able to apply that to your own personal risk assessment, then you will be able to determine what's most relevant to your situation. All right, so it's a three-step process. So is this real? No, I don't think it is. All right, it's somewhat of a composite of a photograph that's made to look like there's this hole in the body of this young lady, but it's not real. And a lot of what you hear about back pain treatment isn't real. It's not accurate. Much of what you hear is based upon marketing materials that are trying to persuade or encourage you to take one treatment approach as compared to another. So it's not completely objective. There's a little bit of a conflict there because the people who are providing those marketing materials are also those professionals who derive an income from the type of treatment they provide. How about this? Is this real? Do you see a chalice or do you see two faces? All right, perspectives differ. And when it comes to the world of back pain treatment, there are many different perspectives. And it depends on how you view those treatment options. And those perspectives are often determined by how a professional has been trained. So let's talk about what's real. Let's talk about truth. And truth, I think, is sometimes in the eye of the beholder, meaning a surgeon may feel one truth, a chiropractor may feel a different truth, a physical therapist might feel a different truth as compared to a chiropractor or a surgeon. And I see Teresa has just joined the presentation. And Teresa, you haven't really missed a whole lot. So I'm going to go back and just get to the disclaimer that the information that I'm giving you here is based on my own views. I believe it's accurate based on my research, but it's not meant to make a diagnosis or to prescribe care. And I'm not acting as your doctor. And as I also indicated earlier, I do these presentations and I've done them when there is no one here. And I've also done them when there are 50 plus people here. So it doesn't matter to me. I do them every Wednesday and I try to take a topic and go over that topic and then answer any questions there are. And if you have any questions, Teresa, at the end of the program, I'll be happy to answer them. As I also indicated, I have set it up so that the video and the audios are muted when people join because I want to preserve your privacy. At the end of the presentation, you can unmute yourself or I will unmute you and I'll answer any questions you have, or you can go to my SpineCamp Facebook page and just post your question on that page and I'll make sure that it gets answered. So we're going to talk about what's real, how to assess risk, and then determining what is relevant. When you understand what's real, and then when you're able to apply that to your personal risks, then you can determine what treatment approach is the best fit for your life. All right, this isn't real. This isn't real. It's based on the eye of the beholder. Some people see a chalice, some people see two faces, and often that's the way it is with back pain treatment. Not everyone agrees, and in fact, most professionals you'll find, and maybe you've found already, they don't really agree, and that creates a lot of confusion. So now let's get into the truth, and what I want to give you are what I consider some of the truths about spine care. And these are the most accurate statements that I believe can be made, and I'm always open to changing my mind if anyone is able to show me scientific research that indicates that I shouldn't feel the way I feel or make the statements I'm about to make. So let's look at some of the truths. There are at least 200 different treatments for back pain. That's a lot. And there are 23 different clinical professionals who treat it. All of these treatments work for someone. None of them works for everybody. And every professional typically feels that their treatment is the best. That's why when you get different opinions on how you should handle your problem, you'll find that there is rarely any agreement between them. And it can leave you feeling confused, not knowing what to do. Now, here's the big statement, is that no treatment has ever been proven scientifically to be superior or better than any other treatment. And no professional, with respect to the treatments they provide, can be certain of how any treatment will work. So when I was in private practice, I would make my best recommendations of what I felt would work, but I could not be 100% certain. We all make our best educated assessment. I don't want to say guess, because that makes it sound like we're just trying to pull something out of thin air, and that's not the case. But none of us can be 100% certain of whether any treatment that is recommended will work. And that's one of the biggest challenges when it comes to spine care. Now, here's just a literature example that illustrates that. I've got many other literature examples like this. And if you would like them, you can just email me at rdf-10@spinecamp.com. You'll find that email on my website, spinecamp.com, and you can contact me on the contact form. But you can see here as you read this, and this was a very large study that was done years ago, but there still has not been a better study done of this type. It looked at a bunch of different research papers that compared one treatment to another, several treatments to each other. And you can see where it says that there has been no evidence of superiority of any form of treatment when compared to any other form of treatment. And I know that that's probably completely different than what you might have heard when you're out there talking to these different professionals, because many of them feel that their treatment has research to show it's the best. And the thing is, they do. So a chiropractor will have research to show you why chiropractic treatment is the best. A physical therapist will have research to show you why their treatment is the best. A pain management physician will have research that shows you why epidural steroids or nerve blocks are the best. So everyone has research that shows that their treatment is really good. But when you look at it all together from an objective standpoint, there has been no clear evidence that one form of care is better than another. And that's important to understand. Now, here are some additional truths. It's difficult in most cases to focus or identify the body part of your back that's causing the pain. And there are numerous reasons for this. And I go into it in another presentation as a part of my SpineCamp Plus program. That's why it's more important to focus on mechanisms of pain rather than worrying about the body part. And there are three main mechanisms of pain. There is stretch, there's compression, and there's shear or friction. And I talk about those in the SpineCast Plus program and show how that can be applied in day-to-day situations to help avoid injury or to help avoid re-injury. The MRI that you have cannot make the diagnosis or determine the type of treatment you should receive. And in fact, many of the abnormalities that you see or may have seen or heard about on your MRI are also seen in people who have never had a day of symptoms. So that can be very confusing. And I've worked with so many clients who have gotten all hung up on their MRI findings that have created a lot of unnecessary fear that led to a downward spiral because they were overly focused on their MRI. And if you'd like to know more about this, you can go to my YouTube channel that can be accessed from my SpineCast website. And I have an entire program there that is called You and Your MRI. That's a video program where I go through all these findings, explain what they are, show you what they look like on an MRI, and discuss their clinical relevance. But the point is, you can't use the MRI as the indicator of treatment or a diagnosis. There's no such thing as a fix. It's a word that I detest because a fix implies that if you do something, it's going to be perfect and you'll never have a problem again. The fact is, your spine's always going to be subject to stresses, and anytime the stress on the spine is more than what it can handle, there's the possibility that you or I would experience pain, even if it's a perfectly structurally healthy spine. Most low back pain is going to get better on its own, even if nothing is done. That's why before you go into treatment, it is very important to know what the natural history would be. And most back pain is going to get better in 4 to 6 weeks. And I've explained this many times that if someone goes in for treatment immediately, let's say 2 or 3 days after the episode of back pain, and they're feeling better in 3 or 4 weeks, what you don't know is whether or not you would have felt just as good if you didn't get treatment and if you tried to do proper things on your own to help manage that situation. So I'm not saying treatment's bad, but I'm saying that most cases of back pain, even if it feels really severe, are going to get better on their own, even if nothing is done. Now, if you do get treatment, treatment success is rarely defined the way you might feel it is, the way most people feel it is. And that gets back to where it's all in the eye of the beholder. All right, you and I have one version of success and we want to be perfect, back to normal. But clinically, that's not how success is defined. So it's really important that you work with your clinician and that they give you a clear idea of how success is defined for the treatment that you're going to be undergoing. And I'm going to show you a few examples of that. And then finally, even if your treatment works, there is a good chance that you're going to have back pain again. And that gets back to what I just said, that there is no such thing as a fix. So you have to understand why that back pain occurred. You have to know what you can do on your own to prevent it or avoid those circumstances that cause it. And then if it is there, you have to have the ability to at least implement some basic self-care regimens to see if you'll get better on your own and might not even need treatment. So anyway, it's a jungle out there. There are a lot of different treatments. And here's an article that was written and published in one of the prominent spine journals that talked about spine care being analogous to shopping in a foreign supermarket without understanding the product labels. And you can read through this on your own. And I'm going to read a little bit here where it says patients with low back pain are finding it more difficult to make sense of this growing list of treatment approaches. And it's getting larger every single day. When dealing with back pain treatment, the options appear endless, and they are. They are increasing every year. Yet here's the important thing to note, and I'm going to highlight it with my cursor. These treatment options are often introduced with limited, clear scientific evidence. So what this researcher found was that in today's environment of spine care, it is as much about economics and competition as it is actual clinical science. And that puts you at a big disadvantage. So you've got to know your treatments. You have to understand several things about them. You have to know what they do, how they work, the effect that they have on your body, how long the results last. And that's important to understand because, as I mentioned, there's no such thing as a fix. You need to know what factors can predict how well you'll do with any given form of treatment. And as I also indicated, it is almost impossible to predict with a high degree of certainty how well any treatment will work for any person. But there are some important considerations that can be predictive of the chances of treatment success or failure, and they apply across all different varieties of treatment. And I'll show you an example of what I mean in a little bit. You need to understand how much time is involved to receive those treatments, and then you need to understand how much money is involved. So you gotta know your treatments, and that gets back to understanding what is real. And you have to know that before you can assess your risk. I'll talk about that shortly. So here's a summary of the things that you need to know about your treatments. And in addition to what I'm showing right here, what they do, how they work, how long the results last, what factors will predict how well you do, if any, how much time, how much money is involved, you have to understand or at least be aware of the physical risks, the risks to your health, because there is no treatment that is without a risk. Any treatment that has the potential to do good also has the potential to be harmful if the treatment does not work out as expected. And it's important to be aware of those things. So with that said, let's talk about what a perfect treatment would be if there were such a thing as a perfect treatment. And this is from one of my PDF series called Know Your Treatments, where I talk about the different treatment options. And if this is something that you'd like, Teresa, you can just send me an email or correspond with me, and I'll make sure that I get it to you. I also have another publication that is called What You Don't Know About Spine Care Can Hurt You, and I'd be happy to get you that too if you wanted it. But if there was such a thing as a perfect treatment, you can see here are the key indicators right here. It would be highly predictable. It would eliminate the pain completely. It would fix, there's that word again, the source of the problem, and it would restore the body to exactly the way it was before the problem began. And there would be no potential for failure, and there would be no side effects. But the fact is, there is no such thing as a perfect treatment. You can't predict how well any treatment will do, except for a few things I'm going to show you. It's rare that any treatment is going to result in complete pain relief. Now, sometimes that happens, but that is the exception rather than the rule. There is no treatment that's going to fix you, and by that I mean make you immune to ever experiencing back pain again. And there is nothing that's going to put you or I back to perfectly normal, whatever that is, because our normal changes. And many times when people have talked to me about wanting to be back to normal, they're referring to they want to be just the way they were when they were 18 years old again. And obviously, as we move down the road, we're not 18 years old again. So the best time to actually begin to take care of the problem is when you are young, because that's when you can do what needs to be done to maintain yourself in the best physical condition possible. And with side effects, we already talked about it. All treatments have side effects. So going back to those treatments, I indicated there are 200 different treatments for back pain. The best way to look at them is to categorize them into the categories that I show here. And those are medications that are taken by mouth, injections, non-invasive surgical techniques, invasive surgical techniques, manual therapies, and behavioral and psychological treatments, as well as self-care. Now, you could take those 200 treatments and they will fall in one of those categories that I just discussed. It's important to know the two main goals of treatment are to relieve pain and to restore your ability to function and meet the demands of your everyday life. We already talked about the perfect treatment. I'm not going to do that again. And I do want to get in a bit briefly about relieving pain. I understand how important that is, but one of the biggest mistakes that I've seen many people make is to focus solely on the pain relief without seeking to correct the underlying biomechanical issues that may be contributing to that pain or inflammation. And if you just suppress the pain, but don't do what could be done to correct the underlying mechanical issues, that problem is only going to worsen and become much harder to treat. So, getting back to navigating the jungle, we talked about success being in the eye of the beholder. Let's talk about treatment success. This chart that I'm showing you right here came from a research article that was looking at medications, but it is a real good guide of how to assess success or response to treatment. Now remember, as I said, some treatments do completely eliminate the pain. There are some people that undergo treatment and their pain is worse than it was before treatment. Most people fall in between on a range. But here is how success can be looked at or treatment can be judged for most of the options that are available. And so let's take a look at pain. And a slight or small improvement with any treatment would be 5 to 10 points on a 0 to 100 pain scale. Or it would be 0.5 to 1 point on a 0 to 10 pain scale. You can see here what moderate improvement in pain would look like. It would be up to 20 points on that 0 to 100 scale, up to 2 points on that 0 to 10 scale. And a large substantial improvement would be greater than 20 points on that 0 to 100 pain scale, or greater than 2 points on that 0 to 10 pain scale. Now, the reason that I'm giving you these numbers is because if you develop, let's say, an episode of back pain, and you try to wait it out or do things on your own to get that pain under control, if over a week, 2 or 3 weeks, you see yourself improving by 2 points on a 10-point scale, you are doing statistically just as well as you would be doing if you underwent any type of formal care. So that's on the pain scale. The other way success is measured is on what's called a physical function index. And I'll show you what that is. And most or many research papers or clinicians use what's called an Oswestry physical function or disability index. And you can see a slight or small improvement would be 5 to 10 points on that Oswestry. A moderate improvement would be 10 to 20 points, and a large improvement would be greater than 20 points. Now, as part of the SpineCamp Plus program, I have a whole section that talks about metrics and how you can use the forms that clinicians use to measure your own progress, compare one treatment to another, and to make sure that you're making the progress that you should be making based upon clinical scales rather than having it being purely subjective. Now, your clinician hopefully is using this form or these forms, but unfortunately many don't, or many don't take the time to explain to the patients they're working with how to assess success on these various scales. So I'm not saying that you wouldn't respond 100% or extremely well with treatment. What I am saying is that you need to look at the statistical averages to get an idea of what's meant by success, because numerous scientific papers have shown that there is a high percent of dissatisfaction in the treatment for back pain, and that is largely because of the patients getting those treatments, and in particular surgery, having unrealistic expectations from that treatment they receive. So you got to know how to keep score the right way. And again, in the SpineCast Plus program, I go through that in depth and show you how you can do it for yourself. So there are three main things to score. We talked about pain, we talked about physical function, and the other one is fear of movement, or what's called kinesiophobia. That's a really important one. Pain is straightforward, 0 to 10 scale or 0 to 100. I had just given an example of what small, moderate, and substantial success or progress would be along those pain scales. Physical function is measured by a questionnaire called the Oswestry Index. And here it is. And you can take a look at it. And you can see there are 10 different categories. And each category has 6 potential selections. The way this form is scored is that each selection down 1 from the top is equal to 2%. And the lower you get within each category, the worse you are functioning in that particular area. So for example, for pain intensity, you can see right here, I can tolerate the pain without having to use painkillers. That would be graded as 0. Painkillers have no effect on the pain, and I do not use them. All right, that means that it doesn't matter what you do, it doesn't get any better, and that would be 10% on that scoring. And so the same is true with personal care, lifting, walking, sitting, grooming, etc. The whole idea of this physical function scale is to look at how back pain is affecting your day-to-day activities and your lifestyle. You see, years ago, and in particular with surgery, someone would go in and they would have surgery. And let's say they didn't get the results that they wanted. They still had pain, maybe as much pain as they had before, sometimes even worse pain. And they'd go into the surgeon and they would say, hey, what's wrong? I'm still having pain. And the surgeon would look at the x-rays and say, hey, you're fixed. The fusion is perfect. The disc space is returned to normal. And so I don't understand why you're feeling the way that you're feeling. And so success used to be judged years ago just upon what the post-surgical x-rays looked like. And eventually, over time, thankfully, it came to be recognized that success should be judged based upon the patient who's undergoing the treatment. Now, the fact is, let's say you have a disc that's a little bit degenerated. You don't necessarily go in to get that degenerative disc fixed. You go in to improve your physical function and to relieve your pain, whether the pain's coming from that disc or not. So what's more important than, quote, fixing that disc is how well any treatment is going to affect positively your ability to function in your day-to-day life. And that's why these forms are used, and it's one of the most important things that you can do to know where you stand right now and to get an idea of how much improvement you could expect. And again, I go through that in the SpineCast Plus program. If you're interested in learning more about that, you could reach out to me. Now let's look at fear of movement or kinesiophobia. You recall that I talked about how there are very few factors that predict how well anyone will do with treatment. But kinesiophobia is one of them. And there's a questionnaire called the Tampa Kinesiophobia Scale that is probably used as often, if not more often, than any other scale. And what this does is it takes a look at an individual's fear of movement because of the pain that's experienced and because of them possibly worrying about causing themselves further harm. when fear of movement becomes embedded in someone's psyche, whether it's mine or yours, but when we become afraid of everything that we do, it leads to a downward cascading spiral where each movement creates more apprehension. And study after study in the scientific literature has shown that by itself, a high degree of kinesiophobia or fear of movement is an independent predictor of a bad outcome with any type of treatment. So this is always something that should be scored. And in the SpineCast Plus program, I also discuss how to score this and talk about what these various scores mean. But if you have a high degree of kinesiophobia, that needs to be gotten under control first before other treatments are attempted, especially surgery. Or at least it needs to be controlled along with or concurrent with any treatment that you're receiving. And when there is a high degree of kinesiophobia, that is not the time to undergo an aggressive treatment like an aggressive surgical procedure. Here's an example of a scientific article that talked about that. Kinesiophobia and catastrophizing kind of go hand in hand. This falls into the behavioral or psychosocial aspect of back pain. And over the last several years, it's actually been shown that how we feel about our pain plays a bigger role in our recovery than our actual structural problems or the structural pathology. And I don't like to use the word pathology because it makes people seem like they're damaged goods, and that's not the case. But the point is, if there's a big fear of movement, and if individuals are walking around either because they've seen family or friends have a terrible experience with their treatment and they start fearing the worst for themselves and thinking the worst about every potential situation, that's catastrophizing. And that also is going to lead to a greater chance of a poor outcome with treatment. So those things need to be discussed. And it doesn't mean that someone's making it up or it's all in their head. I mean, we're all the same. I'm the same as you. Pain is not only that sensation that we feel, but it's our emotional impression of what that pain means to us. And so it's not that people are making it up. And unfortunately, far too often, I've seen many who have told me that their clinicians have tried to make them feel that way. No. We all have an emotional experience to our pain. And to us, that emotional experience is real. But it can be counterproductive. And it needs to be addressed to give us the best chance of healing the way that we would like to heal. So I'm going back to this success. And what you would do is you would apply that 0 to 10 pain scale and that physical function scale on what's called the ODI right here. And, again, I think I get more explanatory in that SpineCast Plus program where we go into detail about how to score it and what different levels of improvement are. My point here is success is not a perfect cure. So expectations have got to be realistic. And then finally, we got to look at risk assessment. And we all have the same 3 risks. They apply to us in different ways. And those same 3 risks are risk of time spent, of the money that we're going to spend, and of our lost physical function or vitality. There's a risk for doing something, okay? Whether it's surgical care or chiropractic or physical therapy or medication, there's always a risk of doing something, and there's also a risk of doing nothing. And we've got to be able to understand how to assess our risks in a very practical way. All right, we have to look at, what do I have to gain? What do I have to gain if I do nothing? What do I have to gain if I undergo a certain procedure, whether it's surgery, injection, chiropractic? Again, the exact treatment doesn't matter. And then what do I have to lose? Now, I'm going to give you an example. It was, I don't know, a year or so ago, I was in my gym, and there was a firefighter that worked out there, and he worked out regularly, and he knew that I was in the spine care business, and he asked my opinion on something. And apparently he went in to see a surgeon because he had some back issues for a while. He had an MRI. The MRI showed a disc that was degenerated, and he was in his 50s, but he was still working. He was still active. And the surgeon said to him, well, while you're young, you should get this fixed while you have insurance and before it worsens. And he said, what do you think about the surgery? And I said, well, look, number one, I'm not your doctor. I haven't examined you, so I really can't say with any degree of confidence. I go, but let me ask you something. I see you in here working out. Do you have any trouble working out? And he said, no. I go, you're working, right, as a firefighter. It's a demanding job. You have any trouble at work? He said, no. I go, are you sleeping okay? He said, yes. I asked him if he was taking pain medicine. He said he doesn't really need it. I asked him about his intimate life and his ability to handle his household duties, and he was able to do it quite well. And so my question to him was, what do you have to gain by undergoing a surgery? You don't have a procedure, in particular a surgery, to fix a bad disc. You have that surgery to improve physical function that is not improving in other areas. So with this individual, he had far more to lose if that surgery didn't work out than he had to gain at that moment in time. Now, that's not saying that things wouldn't change over time. They could. But, and one thing that I want to get across here, even if your MRI shows that you have a disc that isn't like it used to be when it was 18, that may be degenerated, that has nothing to do with whether or not you will experience back pain in the future. And there is no way that anyone can say to you, if you don't take care of this now, then it's going to become a problem. If you're functioning well right now in most areas of your life, and if you're able to work, and if you're able to work out, and if you're sleeping decently, and if you're not taking a lot of medication, then there is very little to gain by aggressive procedures and much more to lose. So you got to look at reality. You got to look at your risks in terms of time, money, and health. And that's where it gets to understanding your treatment options, where that slide that I showed you earlier, what they do, how they work, how much time they take. And we're all different in that. And also that's a part of the SpineCast Plus program. And I know I can't get into that right now, but these are the things that I go into because they are so rarely discussed in most clinicians' offices today. So it's not as though I'm recommending one form of treatment or another, but I help people develop a rational approach to making rational choices for their care. So a final example with reality, risk, and relevance is stem cells, all right? Stem cells in a perfect world would be great. There is very little risk of physical harm. There is the appeal of regenerating parts of the body that may have degenerated or helping to restore structure and function and health, but they are very expensive. And there are no factors that predict who is going to respond well to stem cells versus who won't. So in this time, money, and physical function of risk assessment, if there is someone who has all the money in the world and spending a lot of money on treatment and not having that treatment work out, if it wouldn't affect their lifestyle, then that's no big deal. However, if there is someone who is getting by hand to mouth, barely being able to put food on the table, and spending a lot of money on a treatment like stem cells, even though it might not be harmful to them, that risk probably isn't worth it. So stem cell treatment, if I'm a wealthy individual, if I have time to wait to see if the treatments work, and these treatments you really don't know whether they're going to work for 2, 3, or 6 months. So if I have all the money that I need, if I have all the time that I need, and if I know that stem cell treatments have very low risk of potential harm, then I am probably going to undergo stem cell treatments. Not that it's better than any other, but it could be better for my situation if it happens to work for me. Now, on the other hand, if I'm working in a factory, if I am barely making enough money to put food on the table, if I can't afford the time off of work, and if taking that large amount of money out of my pocket would significantly compromise my lifestyle, even though the physical risks of stem cell therapy are low, I don't think that I would be wise to go into that type of treatment not having some degree of assurance that it was going to work out. Now, giving another example of spinal fusion surgery, all right, if someone is not working, if they have 6 months or so where they have to get back to work, otherwise they'll risk losing their job, if they have tried other forms of treatment that just haven't worked out, if they're becoming more dependent upon medications, and if there is one level of disc involvement that shows on their MRI, then a procedure such as surgery may be worthwhile because that individual doesn't have the time to waste. They don't have the money to spend on a therapy that has no real scientific proof to it. And the chances are, especially if the indications are there, that if someone has that surgical procedure on their back, it could give them a better chance of getting back to work, then that procedure may be a better choice for them. So there are a number of shades of gray between the examples that I have just given you. And when I work with people individually, I help them sort through those shades of gray and ask the questions that are pertinent to their situation. But my point here is you got to understand what's real, what the treatments involve, how success is measured, and how to keep score. You got to know your treatments so that you can take a look at your own personal risk assessment in terms of time, money, and physical function. And then when you put those together, then you can determine which treatment is the most relevant for you. Now, I'm biased. I feel most people could be able to take care of back pain on their own by knowing just a few simple things. It's also my opinion that back pain is over-treated and over-marketed. But again, that's just my approach to it. I'm not saying that that's 100% right, but that's where I feel everything should start.